Okay, thank you. I'd like to thank the opportunity to be here to present my work. What I'm doing now is the measure of the monochromatic ocular wavefront aberrations in real time. So, as you know, the optical properties of the eye are not static. It changes continuously over time with factors such pupil size, accommodation, the tear film. So, system like that can be used to study, for example, the changes in ocular accommodation, in ocular wavefront aberrations with accommodation. You can use it also to study the dynamics of the tear film. It can be applied in several fields. First, I will just do a brief introduction to ocular wavefront aberrations. I will explain also briefly the technique that we used, or we are using. Okay, thank you. And I will show you some applications that we have done with this system. So, what are the wavefront aberrations? In a perfect eye, an image point at the retina will diverge and after past the crystalline lenses and the cornea, we'll have planar wavefront. This is an eye with no aberrations, so the perfect eye, but it not exist. So what we have are eyes that are aberrated. So the wavefront that leaves the eye is not planar, is distorted. So we need, and we like to measure how distorted this is. So you can use an aberrometer. There are several types of aberrometers. You use a Schack-Hartmann. What you have is we have a light from a laser or a SLD that is sent into the eye and is focused into the retina. And the light is reflected, emerge from the pupil as an aberrated wavefront. Then there is a lenslet array, a small array of small lenses that will form an array of the spot images in a CCD detector. In a perfect eye, the lenslets form a regular grid of focal spots here. They have all the same size and they're all equal spaced. But in the aberrated eye, we have something like that. And if we evaluate the distance or the spatial displacement of each this spot relative to the optical axis, we can have an idea or can measure the wavefront aberration of the eye. Okay. Of course, this is important to reconstruct the wavefront aberration of an eye, but we need something that in the clinic we can evaluate. So usually we can have a three-dimensional representation of the wavefront or a two-dimensional, like a map, like this. But usually the wavefront is described as a set of Zernike polynomials, and here we have several of them. Up here, we have what we call low-order aberrations. Here, we have defocus and astigmatism. Those low-order aberrations can be compensated with glasses or contact lenses, and we have high-order aberrations that can impact the optical quality of the eye, the image that is formed on the retina, but cannot be compensated by the ophthalmic lenses. Here, that spherical aberration can be compensated with intraocular lenses, spherical intraocular lenses. So, technique, we have an experimental setup. It's not a commercial instrument. This is an barometer, a Hartmann-Shaker barometer. Here we have also part of this system can photograph the retina, and we can compensate the aberrations of the eye, and we can see or make image of the photoreceptors, but this is not the part that we are interested in now. In this barometer, we have a lens selector. Here we can attach several lenses that are using to stimulate the accommodation of the subject. It is integrated in the system. It's controlled by the same software that controls the barometer, so we can acquire information about the wavefront aberration at the same time as we know or we can resist the position of this motor wheel. So you know when the stimulus has changed during the time we are measuring the wavefront aberrations. So the operator can see in real time how the aberrations are changing. Okay? This information is saved. We can select it if we want to save it continuously during 1 minute, several minutes, with intervals of 1 second, half a second, a quarter of a second. It depends what we want. So the data is then saved as a text file and can be exported for another software that we can use like Excel, MATLAB, Mathematica, then to compute the information. But this software can give us the wavefront aberration and the Zernick coefficients. From the data, here is a graphic from the data that was exported to an Excel, for instance. Here are several Zernick coefficients, the variation, the changes over time. Here we have 2 points that are different from the others. It's corresponding to blinking of the patient. So we know here and here that the subject has blink. So we can remove these points if you want. Some applications of this system. One of the applications that we have done was to measure or try to see how the ocular wavefront aberrations changes during the measurement of the breakup time. So what have we done? We have asked the subject to blink and then to open the eye and keep the eye open as long as possible. And the data was saved during that time, here during 13 seconds. Okay. So this is the raw data, is the data not computed. So from here you can have many information about the behavior of the optical quality of the image and the optical quality of the eye more tear film. Here we have, for instance, a graphic showing the variation, the changes of the low order aberrations that one can be compensated with ophthalmic lenses, and we can see that the second astigmatism, the first astigmatism, oblique astigmatism, does not change over time. Instead, both defocals and the horizontal or vertical astigmatism changes over time. The time that the tear film break is almost here. So in time, with no blinking, if the subject keeps his eye open, you can see that there's changes in the quality of the image that is formed into the retina. You can also analyze the eye order aberrations. They are much more, they change much more over time than low order. And you can see that some of them also increased with the time. The spherical aberration also increased the time. It's almost constant during the time that the tear film is completed over the eye. Since the time that there's a rupture in the tear film, the spherical aberration increased also. You can also see how RMS is the total influence of all the Zernike coefficients, and we see that they are almost constant, and about 8.5 seconds it increased. The breakup time of this subject was almost 8 seconds. This is a normal tear film. If we applied it to a dry eye, this will increase much more than in a normal eye. You can also use this, for instance, if you want to see the effect of artificial tear in a subject. You can installate the artificial tear and see along the time what happens, if it's get better or not. In a dry eye, the normal eye is not necessary, of course. It's also important and interesting to see how it impacts the image that the patient or the subject is seeing. I have here a little video, but I will show you at the end because I cannot change from the PowerPoint to that program. It takes some time, so if you don't mind, I'll show you at the end of the presentation. It is one of the applications. We are using it for study the changes in ocular operations with accommodation. It's our main research interest with this system. So we have measured along not the time here, we have that motor wheel with several lenses that goes through a minus lens of half diopter to -4. Okay? In position 0, you have no lens, so the subject is not accommodating, and here the power of the lens is increasing, and so the subject, to focus it, must accommodate it more. This is the raw data. There are all the Zernike coefficients that we have acquired. We can acquire even more, but those are more important. And here we have the changes on the low-order aberrations, and we can see that defocals is the coefficient that changes more as expected. From this data, we can, for example, represent, in blue, we have the stimulus. We know the distance from the fixation target. We know the value of the lenses in front of the eye of the patient, so we can know the stimulus. Of course, here, at 0, as I said, there are no lenses in front of the eye, but the patient has an hyperopia of half diopter, so that's why here the stimulus initially was not 0, but half diopter. So in orange, you can see the response from the subject trying to accommodate to focus the image through the several lenses. In gray, we have the mean response for each lens, for each position of the motor wheel. For this subject in particular, what we can see is that at here, or for more than 2 diopters of accommodation, it tends to over-accommodate. So the response is higher than the stimulus. One more interesting thing is after we made him accommodated 4.5 diopters and return to 0, he cannot relax completed his accommodation. So it's the case of the subject that when are reading and look far, he cannot immediately focus what he's seeing. From that data, we can also see what the patient is trying to do. Here is a set of images of simulation. Here we have changed the position of the lenses, and during that time between 2 positions, the patient is trying to focus. The focus is not immediately. It takes several milliseconds to achieve the image, the focused image, like that here. So I'll have here also another simulation of what the patient sees along all the process when we are changing the stimulus. We have applied the same measurements to another subject, a 25-year-old subject. Of course, his accommodation is not as higher as the 25-year-old patient. So here we went in the opposite direction. We start with the -4 lenses, and we decrease the power of the lenses. So here we can see that the accommodation of the subject was not enough to focus through that lenses, as expected, because with 45 years, the accommodation amplitude is not so higher. But it's an example that what's going on with that subject. Here, the RMS is too high here at the first and second lens stimulus, the higher stimulus, and then it comes lower. So I will show at the end again another demo. So now what we're pretending is to measure directly the wavefront operations of the lens, the crystalline lens, using the barometer that I've described to you, and another technique, another instrument that we have developed at our Center of Physics. With that system, we can measure, we have already done it, we can measure the lens, we can, in several, we can acquire several images with different orientations of the anterior segment of the eye, and then we can reconstruct a 3-dimensional model of both cornea and the crystalline lens. What we are trying to do now, that's what we are studying, is to relate both the modifications, the changes in the lens shape, with the ocular changes during accommodation and see what is the impact of the changes in the crystalline lens in the ocular wavefront aberration. Okay, another demo. We have also applied it to intraocular lenses. It's much more difficult to see because it's transparent, so it's not easy to reconstruct the image of the intraocular lenses, but we can see here the cornea, the iris, and the intraocular lenses here. So one of the things that we would like to do is to study also the changes in aberrations in intraocular lenses that simulated the accommodation process in phakic subjects. So what we expect is to be able to measure directly the aberrations of the lenses. Until now, this is done measuring the total ocular wavefront aberrations, measure the corneal aberrations, and the difference gave us the internal wavefront aberration. What we intend is to measure directly the ocular, the lens wavefront aberrations. This will allow us to better understand both the accommodation process and presbyopia, and with it we can help developing and refining surgical procedures to restore accommodation in presbyopes, and, for instance, helping planning accommodation intraocular lenses designs. Thank you very much for your attention. I'm going to show you that videos. Okay. This is during the measurement of the tear film. You can see that here, when the tear film breaks, the image came defocused. It's not focused. And you can also see the same for during accommodation, how it's changing during the time that the subject is trying to focus. And in a 45-year-old subject, is much worse. Most of the time, it cannot focus the letter. Okay, thank you.